Teclistamab is a BCMA-directed bispecific antibody that has been evaluated in a dose escalation phase 1 study with both IV as well as subcutaneous formulations. I had initially presented the IV formulation first look data at ASCO in 2020 at the virtual meeting, and then the subcu formulation additions were presented by my colleague Al Garfall from UPenn. So essentially, this is a study. In the first part, the goal was to have a dose escalation and identify the recommended phase 2 dose. And the second part was looking at the safety and tolerability with that recommended phase 2 dose. This is a heavily pretreated patient population of about 6 median prior lines of treatment, with high proportion of patients being refractory to last line of treatment, almost 90%. Triple class exposed, almost all the patients, pentadrug exposed, about 2/3 of the patients. So fairly refractory patient population. What we found was, in terms of safety, hematologic side effects were common as expected for this patient population. CRS was seen in 55% of the patients overall and 64% with the subcutaneous recommended phase 2 dose of 1,500 micrograms per kilogram. And there were 33 patients treated in that subcutaneous cohort specifically. All the CRS was grade 1 and 2, very easily manageable, and did not result in discontinuation of treatment for any of the patients. And then the median time to CRS was 2 days, and resolution was 2 days as well. And tocilizumab was utilized in roughly 23% of the patients for the overall study. For the subcutaneous formulation, 20%. Overall response rate for the whole study cohort of the subcutaneous formulation was 73%. In the evaluable patients. Median time to response was a month. Of the responders, 70% were triple class refractory. 75% were of the pentadrug refractory patients actually responded. So overall, quite active and effective. Overall, 11 evaluable patients, IV and subcu, were eligible to get MRD negativity testing, and 8 had MRD negative CR at 10 to the minus 6 and 1 at 10 to the minus 5. The teclistamab appears to be safe, effective, and is moving forward in an expansion cohort. And we'll hopefully have more data at the upcoming meetings later this year in 2021.